Hello. Today we are going to talk about a very basic question. Who is a pediatric surgeon? Well, we are basically very gentle people because we treat the most gentle of souls. And sometimes they need our help. Now, we treat basically any child starting with the first day of life up to 18 years of age. And now some advanced centers have started doing fetal surgery as well, where basically the child is within the mother's womb itself. So basically, pediatric surgery involves a very wide spectrum of surgical problems in children, including a lot of congenital malformations which have been there since birth. And that involves neonatal surgery, which is within the first month of life. Along with that, there is the pediatric urology, which deals with the kidneys, the ureters, the bladder, and genitourinary reconstructive surgery, which includes the private parts, which in males is the penis, the scrotum, and the testes, and in females it is the clitoris and the vaginal opening and the skin surrounding it as well. Along with that, there is of course pediatric gastrointestinal surgery, which involves multiple organs in the tummy, like the liver, the stomach, the intestine, the spleen, and sometimes the potty area itself is not formed, which is called the anorectal malformation. Now there is pediatric thoracic surgery, which deals with the chest, and that includes not only the rib cage but the lungs, along with that the windpipe called the trachea and the food pipe, which is the esophagus, and the muscle which separates the tummy from the chest, and that is the diaphragm. There are a number of congenital malformations in the brain and the spine, so it's called pediatric neurosurgery, wherein there is built up of fluid within the brain called hydrocephalus. There are multiple swellings on the head called encephaloceles, or on the back called meningomyelocele, myelocele. Now, unfortunately, there are certain children who have cancer, so we deal with pediatric surgical oncology. And there are certain miscellaneous problems like there are cysts or there are openings in the necks or in front of the ears. There are problems with the nails, and there are multitude of other issues that we deal with on a day-to-day basis. So the job of a pediatric surgeon does not only end with the surgical management of the child, but it is imperative that we deal well with the attendants of the patient, who most of the time are young parents who are very anxious and apprehensive because they've been told that the child needs surgery. And it is very important that we do such good counseling that they can trust us. So it is a very holistic approach towards a child who needs help. If you think that your child has a surgical problem, you should consult a pediatric surgeon and get it dealt with. Thank you.